Thank you, everyone. I am Hasin Rehana from University of North Dakota. Today, I'm going to present our work on PICO or PECO guided large language model extraction and ontological modeling of structured occupational safety and health evidence from biomedical literature. Let's start by looking into why occupational safety and health data are challenging to work with. Occupational safety and health, or OSH, studies how working conditions influence injury, illness, and well-being. Most OSH evidence is buried in unstructured narrative text across thousands of papers. It is a cross-domain cross-domain, touching clinical, environmental, and behavioral factors, and the literature grows faster than the manual curation can keep up. So we need automated, scalable extraction that still preserve the context and meaning. To bring structure to this messy evidence, we used the PICO or PECO framework. Here, P means the population, is the occupation and the context. I or E is the planned or unplanned factors. C is the comparison, which is the control or alternate setting, and ultimately the outcome is the health or risk measures. So now let's see why large language models. Traditional NLPs relies on static dictionaries or rules, and it cannot handle variations in the biomedical language. On the other hand, LLMs capture contextual meanings, distinguishing, for example, mask use from mask mandate, and generalize new topics without fine-tuning. So when we constrain them with PICO or PECO prompt, they extract structured relationships directly from the text. The flexibility and structure makes them ideal for large-scale OSH literature. And then to normalize occupations, we rely on ontology. The occupational ontology, or OCCO, formalizes occupation types based on US standard occupation classification and ONET systems, which currently includes around 1,600 classes. It provides machine-readable structures to represent jobs, skills, relationships, enabling normalization of the diverse occupation terms. Now, with this foundation, let's see how our full methodology works. We feed PubMed abstracts into open source large language models, for example, GEMMA, Llama, GPT-OSS, guided by structured PICO or PECO frameworks, prompts. Each abstract then yields a JSON record capturing the population, exposure or intervention, and outcome and comparison. And then we normalize the text and map the occupational field to the OCCO, followed by ontology-based normalization and analysis. Then let's see how the prompt looks like. This slide shows an actual prompt. It defines each PICO or PECO elements clearly and forces the model to fill the keys like type or details for exposure or outcomes. By structuring the instruction, we limit hallucination and get highly regular JSON outputs that can be parsed automatically. And then we validated the pipeline with a very specific domain, COVID-19. We applied the pipeline around 13,000 PubMed abstracts containing occupation and COVID-19 terms. This domain was ideal because it is fast evolving and rich with occupational exposure from different domains. So our goal was to demonstrate that if LLM could scale and capture hidden patterns of the occupational risk for COVID-19. So here is one structured record looks like. It captures the study population of the abstract, what interventions or exposure occurred, the comparison group, and the outcome in easy machine-readable JSON format. Such records can directly be ingested into knowledge graph framework for semantic analysis. After this extraction, we normalize the occupation using OCCO. Across all 13,000 abstracts, the LLM extracted around 4,000 unique occupation mentioned, but then we used a conservative fuzzy matching with a threshold of 98% match with the OCCO dictionary, and then we found 394 terms matching with OCCO, which corresponds to 141 unique standardized occupation classes. The remaining terms could not be mapped, partially because of the OCCO currently lacks biomedical specific fine-grained roles like healthcare workers, hospital staff, doctors, and partially because our matching pipeline is still limited. It's still under processing, and handling synonyms or abbreviations and partial matches. This bar chart shows the top 20 occupation classes in this COVID-19 research. Healthcare social workers, licensed nurses, and physicians dominates in this list. Normalization lets us aggregate similar phrases and quantify evidence frequency reliability. And then now let's look into the co-occurrence pattern between the occupation and exposure factors. In this heat map, we can see that how often one occupation occurs with specific exposure. Brighter cell indicates stronger links. Healthcare roles cluster around PPE usage, IP settings, ICU settings, and patient contacts. Now let's zoom into one specific occupation, which is nurse. And for this one, we looked into what are the factors that cause lower risk and what are the factors that cause higher risk. And we saw that the LLM identified around 280 conditions linked to the higher infection risk and 12 associated with lower risk. Higher risk contexts include working in the ICU without PPE, night shifts, staff shortage, and some others. And on the other hand, protective factors included vaccination, short-term training, and strong relationship. So now, to conclude this presentation, I'd like to say that we built a PICO or PECO guided LLM pipeline that converts unstructured text into structured OSH evidence. And from 13,000 abstracts, LLM extracted around 4,000 unique occupation mentions, 394 matched to the OCCO, representing around 141 unique classes. The unmatched terms reflect both the ontology gap and the limitation of our current mapping pipeline. But this provides a foundation for ontology-based integration and causal modeling of OSH evidence. So our future plan includes improving the OCCO mapping coverage through better normalization and synonym handling, classifying all the identified occupations for advanced semantic analysis, and develop a LLM assistant to suggest new occupation terms to OCCO, apply the pipeline to injury and body substance exposure domains, and finally also integrating the institutional OSH datasets for multi-source semantic reasoning. Let me close by acknowledging our collaborators and supports. This work is a collaboration between her lab at University of North Dakota and he lab at University of Michigan, and it is supported by NIH U24 grant. Thank you for your attention. I'm happy to have any questions.